have a look at this clinical question. It's a three-way split for this one. So the popular answers are A, reassure and advise on lifestyle changes. And we talked about what lifestyle changes might be useful. D, offer combined HRT but transdermal, so a patch rather than a tablet. And then E was the most popular, offer menopause-specific CBT. So if you look at this patient, the main symptoms she's got are the vasomotor ones, hot flushes and night sweats. Okay. And you can see that this is impacting her sleep, but that's likely to be because of these symptoms, right? And then that then has a knock-on activities of daily living because she's tired. But the risk factor here is that she's got a history of breast cancer, and that was a hormone-sensitive type of breast cancer. So the correct answer is E, to offer menopause-specific CBT. Remember what we talked about in the last teaching section, that one of the big changes in the new guideline, that the evidence now supports that even for specifically vasomotor symptoms, menopause-specific CBT, there's an evidence base for it. It can be really helpful. Why not combined HRT if it's a patch? Because there's still a risk of breast cancer if they've got a hormone-sensitive breast cancer. Why might someone pick that? Bit of exam technique. Where could we use combined HRT as a patch where maybe oral would not be recommended? What other risk factor? Type into the chat where it might be an option for us to consider. Great. So a couple of options. So one is, if someone's got migraines, then patches are less likely to set that off compared to if they had oral. But the other one is if they've got an increased risk of thromboembolism, where oral might be a contraindication. Transdermal, the risk is reduced significantly. So there is still some risk, but it's not anywhere near as much. And so it can be used. Okay. So someone might have just mixed up the risk, but for breast cancer, it's not recommended. Okay. Because the risk is still significant. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.